Hi girls, hi girls. What's going on, everybody? How you feeling? How you doing? Happy Tuesday. Good to see everybody here. Working hard like we always do. Hope you guys had an amazing day so far. All my West Coast doctors are on board. Good to see you all. Yeah, I mean, today we're doing pulmonology, and it's stressful just because there's so much to do. It's stressful because no matter what I say, I know you girls know this, there's always hurdles, right? It's always like, I got to do this, I got to do that. So at the end of the day, I mean, you can study for years, 1, 2, 3 years. I mean, I've seen it happen and still not pass. So there's a reason why. And it dawned on me. I said, well, how is it that, because I mean, I also have a team that goes on Reddit and they read a lot of stuff and they send me updates all throughout the day, little topics that I can talk about. Because I mean, I kind of want to, I do want to be able to provide some voice to help people out, because the worst thing that could happen is people take advice from other people that perhaps isn't the right advice, and then they implement it and they don't do well, and then try to find that person to give you the advice. So, rule of thumb: take advice from people that you know, aka people we know each other physically, right? And if you take advice from some people online, that's cool, but be careful, because it might not work for you specifically. It could be good advice, but it might not be pertaining to you, right? Quick example: I'm working with doctors for the match process, and there's something called letter of interest, and you never write a letter of interest. So what's floating around is people are saying you should write a letter and email it to every program before you actually apply to the program. So people who do that don't realize that it's irregular behavior, irregular activity. It's illegal, but because it floats around that you could do that, they do that. And there's one student I'm working with right now currently who last year applied, didn't get an interview. So someone referred her to me. And the first thing I asked her, amongst the many things, was about, things that she did. And I just asked her the other day about letter of interest. She goes, yeah, I wrote a few. And I said, what happened? How did they respond to you? She goes, some didn't. And the ones that did said I shouldn't be sending them this kind of email. So example, that I do my best to give you guys all the advice I can. Any questions you have, any doubts you have, please ask me. Come to me. You guys have my phone number 24/7. Ask me anything and everything, and I'm here for you. Okay. That being said, we're doing respiratory today. So ask yourselves one thing: how do you feel about respiration? How do you feel about pulmonology? Do you like it? Do you hate it? Where are your weak points? Okay. Some of you guys here are taking the test soon, like in less than 60 days. So when that's the thing that we're faced with, you can't just learn everything. At this stage, you've seen a lot. You've seen me quite a bit, and you've seen us answer questions, and that's good. But you have to say to yourself, what do I know versus what I don't? Clearly respiratory is big. Respiratory has a lot of microbiology in it, whether it's pneumonia, atypical, typical, virulence factors. We do a micro tomorrow morning. So this is where you should literally strengthen your points: pneumonia, typical, atypical, microbiology, double dipping, right? Virulence factors, medications, asthma, COPD, chronic bronchitis, emphysema, right? Pneumothorax, bronchiectasis, TB, sarcoidosis. And then granted, as you learn these things again and again, and you work on them, well, there's also, guys, there's also what? There's also virulence factors, there's medications. We know about, if I told you bilateral hilar lymphadenopathy, what comes to your mind? Throw in the chat box. You know the answer. Starts with an S, rhymes with marcoidosis, sarcoidosis, right? So this is the little things you need to know. And I'll be honest with you. I know I care for you all. I know I say a lot and I talk a lot. That's because I care. You should literally have your first aid open. And I'm sorry to say, there's no excuse. You all should be able to read the rapid review once or twice a day. If you can't do anything else, if you're tired, if you're exhausted, if you don't feel good, if you can't write index cards or whatever, at least you can just scan and just scan. I got this technique 20 years ago, well, 18 years ago, when I was with a student, colleague of mine. Was his, yeah, I forgot his name. Ying, awesome kid. And he just had his first aid open. He would just scan, scan, scan. It's a technique that doesn't happen overnight. but it worked for him. He would just read and read and read and read. I never wanted to do it. I thought it was boring. I thought I kind of was procrastinating. But then I went through medical school and I was in medicine for a while, for a long time, and then started the USMLE prep. I realized that he had something. He actually had something going. So I implement this with my students. Open up your first aid and just read the lines. Just scan it, about 35, 40 pages, right? Or 35, I think it's about 30, 32 pages. Do it once or twice, because then little topics and high yield information that you should know will be there exactly in the book. Anyway, all right. Let's raise your hands. Who wants to do some questions? I'm gonna start picking people out of the group. There you go, Dr. Singh. You saved the group because I was gonna pull up. Everyone's pulling their hands up. All right. Let's work with Dr. Singh first. Let's do a round robin, 2, 3 questions. Then we hit Patel on the back end, and everybody else participate on the side. What's going on, Dr. Singh? Ready to go?
Good. Yes.
Good. You see these buildings? This is New York,
Yeah.
man. New York.
New
I love
York.
New York. Yeah, New York is my roots. All right. Respiratory. Okay. Now I know we talked individually about certain things. Do you agree on the plan that we talked about, how you could do a couple of focus blocks of respiration, respiratory, and see patients, like 40, 60, 80 patients, questions, and kind of get a feedback? Say, all right, well, where are my strengths and weaknesses? And then
Yeah.
from there, you can kind of pivot and say, well, is it because I don't know this stuff, or is it because I do, but I have to practice more the interactions, the questions, right? So
Mhm.
do you agree with that kind of approach?
I do agree with it. And also like right now, like since I've been doing mixed blocks today, and I did it in time mode, and I noticed like I didn't perform as well in my first block. But I feel like it was because of the time pressure, because I haven't timed myself as much. So I'm gonna work on that and get better with that situation.
Okay. Now, may I ask you a question? Are you doing blocks of 20 or 40 times?
20.
20. What I would say to get comfortable, if you're doing it timed, you could just throw yourself in the deep end and do 20 until you feel comfortable. Or you
Yeah.
do blocks of 10 timed. Because you see, timed is different than tutor mode, right? Doing 20 questions in one sitting is one sitting. When you want timed, well, let me ask you this. When you did 20 timed, what was the actual performance? Did you almost finish in time? Did you miss a few questions? How did you gauge that was difficult to complete? Or did you finish all
I
20, but you lost a lot of points?
yes, I finished all 20, but I lost points. So when I got to like question, I believe 15, yeah, question
Okay, so
15,
15.
I started like I looked at the time and I was like, oh no, I don't have enough time for like the rest of the questions. So that's where I started rushing, and those are the ones that I miss the most of as well. So that's that. And then I started it like you told me to do, like the hammers, like 1, 2, 3. This
Mm-hmm.
time, like since I had already started that one, I did like before I asked you, I did a set. So I did the 4 and 5 hammers, and that's probably another reason why I probably didn't do as well, because those were
Okay,
hard.
okay. You know, the 4 or 5 hammers and amboss, the hammers are the difficulty level, right?
Mhm.
And it says, and they explain, especially the 5 hammer ones are a reflection, or they basically represent 5% of your actual exam, like the difficult questions, but they're there because it's a Q bank, right? So what I would say is, then what if we just focus on hammers 1, 2, and 3, and then eventually maybe 4. Um, but the first 3 are 85% of the actual test, right? Because you need to know how to connect the dots. So do that for now. And then as you get up and running, just like going to the gym, like I'm not gonna go to the gym after not going for months and stay 3 hours. I'm not gonna make it. I'm gonna walk in and leave, right? But you have to slowly get to it. I get there, I get ready, I go to the gym, drive around, leave, come back the next day, walk in for 10 minutes. Eventually, I'm in there for an hour or so. So then I get discouraged. Definitely hit up to 3 hammers for now.
Okay.
Full week, week and a half. Basically, you don't have to do 5s. I just do it because I just want to make sure you guys are ready for some of those crazy questions they throw at you. But yeah,
Yeah.
so it's all good. Just stay with first 3 hammers, hit it hard every day, stay consistent, and then eventually you can participate with maybe a 4 hammer, but it's not a big deal. I need you to get Remember, a passing score. That's what we need. So
Yeah.
leave the five hammers out for now. Maybe not even put them in. Who cares? Let me test you when you see these sessions here. I have some fibers in there once in a while. I'd rather get the points on the majority and leave the rest out. Make sense?
Yeah.
You're not getting a score of 260 on this one. You're just getting a pass. We want a high pass, of course, we have to pass. So good point.
Right.
Now, respiratory, where is your points of entry? Meaning, where do you feel comfortable with versus just tell me what areas you know you can get points
I
because you're
feel
going to
like
work on
lung
them.
disease is definitely like I'm getting good at, and then also the microbiome with like the pneumonias and stuff.
Good. So you have cancers, pneumonias,
Yeah.
microbiology connection, right? Because they ask
Yeah.
about different bugs. You have viruses, you have bacteria, you have fungi, and every time you mention a microbiology topic, you have accommodating drugs. Guys, these are the points you're talking about. I'm telling you, no one does it this way. And I'm trying to be the pioneer to, guys, there's a way I'm passing this test. Think this way. You can't learn everything. Learn what you can and pass, right? Because what's going to happen is you try to learn everything. You walk in and you're like, I panic. I don't know what this question is. Yeah, because you're not going to see the same question. So we have pneumonias, cancers, maybe like a COPD, right? Chronic bronchitis, emphysema. Two, we can cover that. Asthma, that's pretty fair. You can use, right? Okay. And how about upper respiratory infections? What do we have? Like sinusitis. What else?
Rhinovirus, like
Rhinoviruses, right? Rhinosinusitis, okay.
Mhm.
Pharyngitis, they could talk about mono. So you see,
Yeah.
there's so many points waiting for you. Realistically, all my doctors that I train less than 60 days, I'm like, guys, we can't do it all. I will show you how to leverage, right? That's the mentality I need you to have. Yes? Yes?
Okay.
Okay. Attack. I'm gonna add. I mean, the reason why I say this, guys, a thousand times. I talked to my good friend. Let me show my screen. He's a good. We talk a lot. Even the people like we also need people to talk to, mentors and coaches. And my guy, he goes, man, you just got to keep saying it because he's big in the social media in the internet world, like with the sales and all that, like in real estate. He goes, every time you talk to people, especially online, you have to think as if they never heard you say something. I'm like, what? He goes, because people have to hear it like 1,000 times, like you had when you were a medical student. So I will say it till I turn blue in the face, but I'll never turn blue. My shirt is blue. All right, Doc, let's go. Let's hit it hard. Come on.
Okay.
Tell me what you got.
All right. Sputum analysis shows numerous polymorphonuclear leukocytes and a few squamous epithelial cells.
Okay.
An X-ray of the chest shows bilateral patchy consolidations.
Okay.
Which of the following findings on sputum culture is most consistent with this patient's respiratory symptoms?
Go to the top. Let's knock it out.
Okay, a previously healthy 52-year-old woman comes to the physician because of a 1 week history of productive cough, fevers, and malaise. She has smoked 1 pack of cigarettes daily for 35 years. Temperature is 102.2. Diffuse inspiratory crackles are heard bilaterally. Her leukocyte count is 14,000. Okay.
What do we got? What do you think it is? Now, I need you guys to think this way because you know me, I'm going to go to the answer choices, but we have to eventually get to a point where you read the scenario live and say, I have a feeling I know what it is. Do you have an idea what this could be?
Um, mm,
Previously healthy, right? Previously healthy
like
woman.
I know with the productive cough, fever, and malaise, I'm thinking it's going towards pneumonia. The
Yeah.
thing that's throwing me off is the squamous cell thing.
Okay. That's why they do what they do, right? Everything, there's no randomness on this exam. Every
Mhm.
word they place in the scenario, every answer choice, whether it's Ambos's test writers or the actual exam when you take the USMLE, it is specifically put there for a reason. So we have a previously healthy woman. That's important because we talked about some conditions, right? Are what they fester when there's immunocompromised patients. So when a person is immunosuppressed, immunocompromised, they have other infections, right? Yeah, that's true. We know that the